Good morning, my spicy dental community. You guys have been all up in arms this past weekend about the upcoming changes to the Notice of Privacy Practices for HIPAA. So I just wanted to come on here and clarify for a moment, because the majority of things that were listed in the updates that are due by February 16th of 26, they're mostly stricken down. But there's two big things, That's it. The first one is about redisclosure. It basically says that once something is shared outside of your office, per the terms of whether they're another covered entity like an insurance company or another doctor, or that they are a business associate, someone who creates, receives, maintains, or transmits protected information on your behalf, think like appointment reminder or IT provider, people like that, that once that happens, it's outside of your care, custody, and control, and you can't be responsible for what those people do. They might redisclose it. And it's very simple language. It's very straight to the point. It's not that hard. I even wrote one down. Let me grab it. Once information is shared with someone outside our practice in accordance with HIPAA, meaning you did that appropriately, they're a covered entity or a business associate, it may no longer be protected. Simple language. It doesn't have to be overcomplicated, okay? Now, the second big thing is about substance use disorder information. Well, you aren't directly creating substance use disorder information. You might receive it. You might have it in your medication list. You might have it in health history notes. It might say that they've had a history of addiction, and oh my goodness, what if you have to give them an opioid? I know the chances of that are really slim now, but it does still happen, and maybe you need that information in order to provide them health care. So just because you're specialists of this area doesn't mean that you're not responsible for all of the information that you collect, receive, transmit, and just store. So very simple information. I even wrote a little script for this. In most cases, most dental offices aren't creating that information, and they generally aren't sending that information out of the office, but they might be storing it. So you can say, our practice does not create or maintain substance use disorder records. You might need to modify that if you are maintaining it. If we ever receive these records, we will treat them in accordance with federal law. So very simple language. It doesn't take a lot to update this, but it needs to be done before February 16th. If you're stuck, you need help, there are people in the industry that are more than happy to help you, myself included. It's not that difficult. Don't get your panties in a twist. And let's be honest, this information is older than dirt. That Notice of Privacy Practices, you probably last updated that in 2013. 2013. Think about what's gone on since 2013. A lot. So update it. There's nothing standing in your way. I would say work with an actual professional on this, people that understand dentistry and HIPAA. You know, it's not that hard. I know I keep saying that, but I feel like the tone within all the dental groups, all the social media groups, the messages that I've been receiving is there's this urgency and angst about it. And it's really two simple updates. Then you have to give it to your patients. So that's the HIPAA update for Monday morning. And in the meantime, stay safe, stay compliant, and don't get into any trouble.